There are many advancements in vision correction technology. I have many tools in my toolkit. We have lens replacements for those with cataracts and those for simply with dysfunctional lenses that don't allow them to have the range of vision that they once have. We have LASIK, and we have LASIK with certain options that can actually allow the patient to see better after their procedure than they did with their glasses or contacts before. It's important that you check with your doctor on that particular issue because not every laser has the ability to do that. It's important to check. Maybe you were told in the past that you were too nearsighted or you had too much astigmatism. I would go and get another opinion because things have changed, and sometimes the opinions were in fact wrong, and other times what was right 10, 15 years ago is no longer accurate today. So, for example, for the person who is too nearsighted for LASIK, we have implantable lenses that can go in the eye. In a 3-minute procedure, patient walks out of there being able to see. So my point is that there are many options. There are very few untreatables in this day and age, and that's what's important for patients to know.